Hello everybody, welcome back to my YouTube channel. My name is Jemienaftaly. This channel is on kids welfare, the pediatric world. This is a world of children whereby I create the awareness on common illnesses affecting children while growing up. I do this in layman's language, a language that every person is able to understand, especially the mothers. So I want to bring in everybody into management of these children. So welcome to today's episode. First of all, if you've not subscribed, hit on that red button, subscribe to be part of this wonderful family. And if you are that returning subscriber, you are a favorite person and you don't even know it yet. Thank you so much for your support. Let's go to the video. And the video of today is something we call tongue tie. Tongue tie in children. This is a very, very common condition. And we normally see it in newborn babies after they are born. So if I may go by definition, tongue tie is when a tongue is teethed by a connective tissue, or rather it's hanged or it's held. There's something that is holding the tongue by that part is what we are calling the connective tissue. So if it is held, then we have problems. And we are saying it is commonly seen in newborn babies. 1 in 10 children, you are likely to find one child in 10 with this tongue tie. Also, it is more common in boys compared to the girls. So then how do these children present with, or why is it important that we know about the tongue ties? Signs and symptoms. Number 1, the child has got difficulty breastfeeding or latching to the breast. They are not able, they have got difficulties. Then you are able to see that they are unsettled, even they are unsettled and the milk is not enough despite them staying there in the breast. You see that baby has not, there are signs that this child has not gotten enough milk. Also, they can have clicking sound when breastfeeding. So normally we say we are not supposed to have these sounds, and this is because also when there's that sound, we say the attachment is not okay, it's not good, and we end up even having some air, and these now we call them the colics now, because the air we have gotten air entry because there is no good attachment. So when there is that clicking sound, most probably this child has got the tongue tie, preventing this baby from now breastfeeding well. We also have these mothers with these babies with tongue ties having sore nipples or even cracked nipples, very, very painful. Why? Because the baby is just getting hold of the nipple alone. They are not able to hold the whole part of the breast, the areola, the black part of the breast. So consequently, we get these mothers getting these sore nipples. Those are some of the signs, and mostly it is difficulties in breastfeeding. This is what we find in tongue ties. Now, how do we go about the tongue ties? What is the treatment? We do not have any drugs to give to these children. What we do is a surgery or a procedure, because it's a very simple and safe procedure that we normally do. We call it releasing this tongue tie. So what we do, we get hold of the baby. Now, the tongue tie is usually below the tongue, around here, or even below, down here, below the nipple, there, below the lips. So that is why you're able to find these tongue ties mostly. So the procedure, we are saying the baby is held nicely by the mom. And then now what we want to do first, we want to anesthetize that area, and we use mostly the topical anesthesia. The topical one, we just apply the area with the tongue tie, or other people may inject the anesthesia, but mostly the topical one is the best one for the babies. After doing anesthetizing, now we want to hold that tie that is there. We use a forceps to hold that. While we are doing this, we are cutting down the blood supply to that area, so that when you'll be cutting now that tongue tie, there will be no pain. The area becomes numb. So after we have held with the forceps for around for 4 to 5 seconds, then we release. Now we use the scissors to cut that tongue tie, and we release it from now holding the tongue. So after that, we can use the small finger here. You put your finger inside just to now to release it downward and to make sure now it has gone down, and we no longer have the tie anymore. It's a safe and very simple procedure. So mothers get so worried because of that, and as I'm explaining, it is as that simple. And after the procedure, what we do not give medications, we only breastfeed. Again, breastfeeding now is the treatment of this tongue tie after it has been released, after the simple procedure that I have explained so well. So next thing we do is just breastfeed the child so that the baby just can get used, and after all, we are okay. But we have to be very keen. We might be having some risks. Of course, we have to check on maybe bleeding, excessive bleeding. You have to check on that. Make sure that there is no excessive bleeding. We have to take care to be careful on the pain, any infections. Also, we might have damage to the tongue or even the surrounding tissues. We want to be very careful. We want to be sure that we don't have all these. In as much as we are saying we do not have much or many complications or consequences, we want to be aware of all those things we have said. So this is it about the tongue tie. And if does not happen, if the baby's tongue tie is not released early enough when they are newborns, so in future we might have this child having a difficult speech, not able to talk or to remove the words nicely because the tongue again has been tied. So it is very recommended that we do, if you notice it in a newborn, the earlier we do this tongue tie release, the better. So we don't want to have the long-term complications of now the baby being unable to speak nicely or the speech complications. So that is it. Those who have been worried, check your baby. You're worried that your baby might be having tongue tie. You can take to if you're not sure, you can go to your nearest hospital to see this, and they recommend, they are going to advise you accordingly. So hope I have helped somebody who is somewhere, a mother somewhere who is stuck not knowing what to do. It is doable. There are many, and we have got so many cases of that, and we just, when we notice it, we follow up on it and we do the procedure of releasing. So thank you so much for your time. If you have any question, drop into my comment section a comment. Also, my email is provided at the end of every video. So ask anything that you're not sure of, any clarification about this tongue tie, or even suggest on any topic that you want us to do together. So thank you so much. Again, if you have not subscribed, hit on the subscribe button, subscribe to be part of us. Also, hit the notification bell so that you may be among the first people to know every time I'm posting a new video here. Thank you so much. Until next time, bye bye.